Monday, May 7th, I was scheduled with Dr. Copeland, and we did a few simple appointments. We did a couple of floats here at the hospital, and I held and assisted for her. And so we sedated with Dorm, and she uses a power float, which everybody does. A couple people will touch up with hand floats. And once we did that, then we went out and castrated a donkey, which is super cool to watch. I also ran anesthesia on that donkey, so we got out there and we sedated with xylazine, and then we dropped him with ketamine and midazolam, and we got him down. And basically what my job was is I sat on him and monitored him, and if he was moving at all, or if he was making noises, or his eyes were starting to get nystagmus, then I would need to bump him. Luckily, he was a pretty good donkey, and I only had to bump him once, and that was right as Dr. Copeland was making her incisions. He was kind of moving a little bit and grunting, so we bumped him with 0.2 of ketamine, and then he was good for us the rest of the time, and then we just wait for them to wake up. They don't really like to reverse anything, they just like to let them wake up on their own. And so that was cool. Lexi was there monitoring me, monitoring the donkey. So I was not doing this by myself, but I was basically in charge of the donkey to make sure that he was not going to wake up and kick the doctor. And then that was all we really had. Oh, I take that back. Then we went out, and Dr. Copeland was rechecking a patient she had seen that has EPM, and doing very, very well. I guess when Dr. Copeland said when she first saw her, she was just randomly falling down, whether she was walking or standing. She would just, out of nowhere, sporadically just hit the ground. And when she was trying to walk, she'd be all cross-legged and wobbly and still fall over. And now she is walking really great. She can turn. She's crossing over when she's turning. She's improving a lot. She doesn't flex very well to the right with her head, so Dr. Copeland said that now that she has improved and she's doing a lot better, that she wanted her to bring her into the hospital to take x-rays of her neck to see if she's got any arthritis going on in there. Otherwise, they thought she was on the mend and doing very well. And after that, that is all we did for the day. Tuesday the 8th, I was scheduled with Dr. Stone. She was supposed to be off on Tuesday, so I was really only with her for about half a day, but she had some appointments that she needed to get done. So during repro season, Dr. Stone is basically checking mares and everything every day. She scans them to see if they're ready to breed, or she scans them to see if they are bred. She does embryo transfers, she does AI, she does all of that stuff. So she didn't come until about half the day, so in that morning I was just helping around the hospital with morning treatments and assisting wherever needed. And then when she got there, she has a portable ultrasound on her truck, and then we had to take the x-ray machine with us. And so we went out and took some x-rays on some recheck patients for her that had laminitis, and both of them are improving very well on bute and banamine and everything like that. Both of the horses that we saw, Dr. Stone really wanted to meet with a farrier or their farriers to go over the x-rays and tell them what they need done with their feet to help them stay sound. And then when we came back, she was scanning one of the mares to see if she was ready to breed, and she was. Her follicles and everything were a proper size. I believe that Dr. Stone's happy numbers are between like 30 and 35, but it also kind of depends on the mare and how big they are, what numbers she's truly happy with, so it all kind of differs. So her follicles were large enough and she was ready, so they gave her sucromate, which helps with her cycling and everything like that. And they already had the frozen semen, so they were ready to get her bred and get her going. And then that was it for my day with Dr. Stone. Wednesday the 9th, I was assigned with Dr. Damani. It was actually a really good day. We were kind of out and about all day. We had A lot of vaccines and deworming to do, and it was a lot better than we thought it was going to go because the horses, majority of the horses that we had to vaccinate and deworm were out in pasture, so we had to go out and catch them, which luckily they were pretty decent ponies and they came up to us and it wasn't too much trouble to catch them. So we did the Eastern, Western, Tetanus, and West Nile, and we also did the flu rhino vaccines, and we deworm with a Equitel, which is a pyrantel pamelate, and then we got called out on an emergency for a mini horse that had choke. Luckily, it was a fairly easy choke to do, so the hopes of tubing a horse that has choke is to tube them and essentially push down the obstruction down into the stomach, and if not, try to break it down with water so it comes back up out of the tube and clears that airway. We got out there and she had snot coming from her nose, but it had feed in it, so we definitely knew that she had choke. So we tubed her, flushed a little bit of water, and Dr. Damani said when he was tubing he could feel the obstruction, but after a couple little pushes, he was able to push it down into the stomach, and we flushed her out a couple of times, and then she was good to go. Gave her some Banamine because we were sure that she was pretty sore from that, and of course from the tube, and he recommended to owner that to keep her on some very, very, very watery, soupy mashes for the next 3 days or so, and then get her teeth done, because he thinks that could have been an underlying factor of why she had a blockage, that she's not really breaking down her food as much as she needs to swallow it and not have it get stuck. And then I also went out to Dr. Damani's ranch with him. He had to preg check a couple of cows, which there wasn't a whole lot I could do then because he has a squeeze chute and his whole setup there. But he did explain everything to me, and I did record the conversation, so I'm going to add that to the end of this video. He's a very soft-spoken man, so I'm hoping that you can hear it and get all of the information that I had asked him. And other than that, that was our day out and about doing vaccines and deworming and helping a mini horse with choke. So Thursday was a pretty laid-back day. I was assigned to Dr. Sakai, but he only had 2 appointments on the books, so everything that I was doing in between was just kind of helping around the hospital and doing things here and there, trying to keep myself busy. Our first appointment, though, was a castration on a 3-year-old colt. Depending on the colt itself and depending on if he's cripped or not, it's kind of up to doctor's discretion whether we want to lay him out on the lawn and just do it like we would out in the fields, or we would, or it would determine whether we would take him to surgery and do it with those older, more mature castrations. But he was small enough and he was healthy enough and he wasn't cripped, so we just laid him out on the lawn and did it. Wendy was my technician, and so she kind of instructed me, and I basically ran the anesthesia for this kiddo. We pre-medded him with xylazine and Torb, and Wendy does things a little bit different than Morgan or Lexi with these guys, because a castration out in the field, as long as everything goes according to plan, is a pretty fast procedure. It should not be any more than 15-20 minutes, 20 minutes tops, to get through this procedure, as long as they're not bleeding a lot or anything like that, or trying to come through the anesthetic. So what she likes to do is she likes to figure out what dose of meds they need, and then she likes to go up a little bit. So she's hoping that if she gives them a higher end dose, that she will not have to bump them throughout the procedure and then they wake up quicker than usual. So that's what she did. So we pre-medded with xylazine and Torb, like I said, and then we induced him to knock him down with ketamine and midazolam. And when they're down like that, their vitals and everything are usually pretty stable, and you look at their eye movement. They will blink at you, but if you start seeing nystagmus at all, then you should bump them a little bit with some xylazine, because once their eyes start to go into nystagmus, that means they're trying to wake up. So you want to see them blink, but you don't want to see their eyes move. So he did very well with that higher dose that Wendy put together. His vitals and everything stayed stable throughout. He didn't really peak or anything when they were cutting the testicles or crushing them with the emasculators or anything like that, so it went very well. However, Dr. Booth, who is the intern, she did the castration, and on the second testicle, for whatever reason, because I was paying attention to my patient, she had to crush the second testicle again. So Wendy said, even though he was doing well and it was coming up on 20 minutes, that she wanted to bump him with 1 more mil of xylazine to be on the safe side. Also, another thing that's up to doctor's discretion is whether or not they are going to have them in lateral or dorsal. Dr. Sakai likes to do it in dorsal, so they're up on their back and their legs are kind of up and bent. So if for whatever reason they do kick, they're going to come up instead of back or out or whatever. So in hopes of it going up above doctor and giving doctor a chance to get away if they were to wake up and kick. So with that, also Dr. Sakai, when they crush, they like to start a timer and leave the emasculators on. And he said he does a minute per year. So since this horse was about 3 years old, we did 3 minutes. So you crush, you leave the emasculators on, and you start a timer. Wendy said that it would make all of us feel a little bit better if we bumped him with xylazine. So while we were, because everything else was done, the other side was already done and ligated and everything like that. So with him sitting there, she's like, we have to crush again, and then we have to sit and wait. So it would be best for him to just have that little extra bump of anesthetic, and unfortunately have to wait for him longer for him to wake up. But with doctor sitting back there between his hind legs, it was just the safer precautionary choice, I guess. So that's what we did. And then we waited for him to wake up, and he woke up well. He was up. He did not have any odds bleeding or anything like that. Normal bleeding, because like I had said before, we leave the sac open from where they cut the testicles. So there will be bleeding, obviously, but usually 1 drop per second is normal. Anything 3 drops per second or more, or obviously a good steady flow, that's concerning, and we will probably need to knock them down again and see where the bleeding is coming from and see if we need to ligate something or cauterize or anything like that. But he did very, very well. Our second patient of the day was a horse that I had seen with Dr. Sakai one of my first couple of weeks there. He had come up very lame, and they've done some x-rays and injections and all that stuff since then, but I have not been a part of his case. But yes, so I guess they've been doing shockwave treatments on him. And the shockwave machine is sound waves or acoustic waves that carry super high energy to painful areas, soft tissues, or anything like that. And so the waves are a jump in charge and in the pressure and high amplitude. And you pinpoint it to, so we had it on the back of his forehoof and kind of where the ligaments and stuff run down the back of that heel. And that's where it went. I will try to attach the video of that so you know what it sounds like, what the machine looks like. It almost looks like the cold laser that we use, or like the infrared laser that I've seen quite a bit in small animal. It looks like an oversized one of those, but it's not the same. It's sound waves instead of heat. But it's essentially doing the same thing. It's bringing in regenerative tissues and red blood cells and everything to that area to hopefully get inflammation down and heal whatever's going on with the soft tissue. So that was pretty cool to watch. And it's a very fast process. I think they only did it for about 10 minutes. But the sound waves that are going in there are pretty strong, and you move it around that area. And that was all that we saw yesterday. But I did want to note that I learned something about Everclear alcohol. They keep that on hand for toxicity, just like we would do a small animal. But I did also learn that a lot of people in Texas, around the horse show world, will use Everclear and inject it around the base of the tail to numb the nerves of the tail so the horses won't swish their tails in the middle of the summertime, because apparently, I guess judges don't really like when the horses are swishing their tails, but if it's summer in Texas, there's gonna be bugs and flies. So they're gonna swish their tail, but that's the point of the Everclear, I guess. It's a pretty popular practice to have Everclear injected around that tail so they can't feel it and they can't swish their tail during a show. So that was just a little fun fact that I learned. Very odd. Very, very odd. But that was my Thursday at Comstock in my last day.